Hey, welcome to the Home Health Care Today show. I am your host, Dr. Cleamon Moorer.
Every promise complete.
Our topic this week is National Public Health and Medicaid Awareness. And if you recall, last week we honed in on Minority Health Month, and our distinguished guest was Dr. Alvin Haynes, the Chief Medical Officer of Meridian Health Plan. Back to back, 2 weeks in a row, we are fortunate to have another guest from Meridian Health Plan. Our guest today is Rebecca Daxenbichler. Rebecca is the Vice President of Operations for Meridian Health Plan in Michigan. She's had 11 years with Centene Corporation. She has an extensive background in enterprise implementations of Medicare products, training, quality, and business operations. Rebecca holds a master's in healthcare administration and management from the University of Missouri, Kansas City. Rebecca, welcome to the Home
Thank you
Health Care
so
Today
much
show.
for having me. So happy to be here.
Rebecca, let's just start with a key stat here, okay? 2.5 million Michiganders, that's 1 in 4 residents, are enrolled in Medicaid. 3 in 8 are children, 1 in 6 live in a rural area, and 71% of Medicaid adults in Michigan are working individuals. Okay, now considering that Meridian is Michigan's largest Medicaid HMO, your role as Vice President of Operations for Meridian, you are on the front lines in terms of health access, front lines for millions of Michiganders every single day. Let's go there and look back at that 2.5 million in our state. What do you want every Michigander to understand about Medicaid?
Such a great question to start with.
Yeah.
I would say, when you think of Michigan Medicaid, you really have to call to mind your neighbors, your family members.
Yes.
Think about the seniors in our community, people with disabilities. That's who Michigan Medicaid serves. It's when you hear those numbers again, it's us. This is our community.
Yes, it is. Wonderful. Yes. Now, one of the biggest myths, so as you start to think about Medicaid, a lot of times folks say, well, it must be for people that aren't working, right? That aren't contributing to the society per se. But we understand in Michigan, 71% of folks on Medicaid are actually working adults. So what does the face look like then? You got the working adults, the 3 out of 8 kids, the 1 in 6 in the rural. Talk us through that.
I think it's that gentle reminder for us about what makes someone eligible for Medicaid. Yeah. And there's such a variety of circumstances, of life situations, of conditions that cause for people to need care above and beyond what everyone can normally expect in their day-to-day. And so I think about when you think about that eligibility, it really is, life-changing for people that may be encountering those situations with having this type of care and access. And, again, it's any and every one of us potentially. And, what life events happen to us or where we come from or what we're going through at the time. So.
Absolutely. Very good. So in our conversation, of course, our very first episode of the show, the television show back in January, we heard from Meridian CEO, Patty Graham, and she gave that strategic outlook for the company. We talked with our Chief Medical Officer of Meridian twice now the VP of Operations. So let's go there, Rebecca. In this role, as when you think about individuals and the chronic illnesses, right? So we heard about chronic illness from Dr. Haynes, but from an operations standpoint, what does it look like as you think about the footprint and designing a health plan operationally to cover such a vast array of individuals that have multiple health challenges?
So I think when I reflect on Meridian and the company I'm a part of today, I think our biggest asset and strength is that we are a local company embedded in the community that we serve. Our offices are local, our jobs and our missions is to hire locally, And that's not just by happenstance, it is by very much strategic design. We are part of the community, we are embedded in the community, and that's how we can make sure that we're reacting to the true needs of the community.
Love that. I love it. Yep. So the true needs of the community. And Meridian is a part of a larger construct, right?
It is.
Centene Corporation, right, which you've been with for about 11 years,
Yeah.
right? We clarified the count, right? Centene is one of the nation's leading managed care organizations, working across enterprise, implementation, quality, training, and operations. Your background.
Yeah.
What drew you to this work, and what keeps you here?
So if again, kind of being a little vulnerable with you, I lived in New Orleans. I was actually there during Hurricane Katrina and the events that happened. And, you know, kind of going back to those initial questions, I realized how for any of us at any moment in time, we can have life-changing events that happen. And, you know, the reaction of the community, of the call for social justice has always been really strong for me.
Very good.
And so when I thought about my career and what I could do and my time away from my family or where I wanted to spend that investment and that energy, I thought about healthcare being one of the most important and I would say exciting industries to be a part of, because the outcomes and the impact are you know, I think life-changing, and that's what I wanted to be a part of and what I wanted to join.
Absolutely, yes. And we saw when the levees broke, you know,
That's right.
speaking of New Orleans, a lot of vulnerabilities
Exactly.
of the community were brought to the forefront.
Exactly.
Right? Similar to COVID, right?
Exactly.
As you think about infrastructure and the like,
Yes.
which takes us to
Yes.
National Public Health Week, right? It's all about prevention. Yes, right? We want to stop illness, of course, before it starts, mitigate illnesses wherever we can, slow down the progression of illnesses. But we understand a lot of Medicaid members may struggle with barriers.
Mm-hmm.
We talked in previous episodes, we talked a lot about food insecurity, transportation, safety, housing. How does Meridian, from an operations standpoint, right? Because we, you know, members complete the social determinants of health assessments.
You got it. Yep.
We submit, we provide some resources as providers, but behind the scenes, let's give the folks a little sneak peek from an operations standpoint. What happens behind the scenes?
This is something exciting to talk about because, you know, unless you're really embedded in the industry, you may not know it.
Yeah.
And what's been exciting for me on that journey of 11 years is the change and the evolution that's happened, where we really have moved to a holistic, person-centered approach to healthcare.
Good.
And while we as those folks in the medical community can do everything in terms of their part of providing the best healthcare possible, we know that it's more than just medical. And, you know, I think a great story that I have as a direct experience is, you know, 10 years ago, looking at a Medicaid member and constant readmissions to the hospital, right, for lung diseases.
Yep.
And, you know, your focus there and understanding how to stop the readmissions. And when that care manager enters the home and understands the home environment, then you're really able to take care of somebody because you really understand the true needs. And it's not just medical, it's so much bigger than that.
Absolutely. Yes, it is. Yeah, it is. Going back to Medicaid, it's, you know, because you're talking about members, and to your point earlier, it could be anyone, right?
Yes.
It could be, you know, our next door neighbor, an elderly individual, 3 out of 8 children.
You bet.
When we talk about Medicaid Awareness Month, there's folks that may feel as though they don't qualify for Medicaid. There's been some changes. We understand in some of our previous episodes, like glaucoma awareness, we talked about vision care, get that eye exam, check that eye pressure in the eye to save vision. We had an oral health month, or World Oral Health Day episode where we talked about, hey, get to the dentist. Operationally, though, Rebecca, what are some of the least used or underutilized benefits of Medicaid, and how can we get more members engaged to use those benefits?
I'll do a little building off of that last response, which I would say, it's going to be things that maybe you wouldn't expect. Transportation is one of the most underutilized benefits, and it's available to take you to a medical visit, to any covered benefit that's available under your plan. I know that can be such a challenge, and more of our members, more of this population taking advantage of that can make a material difference. I also think the whole industry, as we come out of the pandemic and COVID and the reaction to telehealth, and the integrity of our physicians that are really trying to meet our members where they need to be met, and allowing, that virtual care in so many ways that can support them. And then I do want to highlight some really innovative practices like the doula services that we provide for our pregnant members, and how that can aid in great health outcomes and just experience during, again, one of those most vulnerable times of life. So those three jump to mind the most.
Oh yes, very good. I could see it. We did a maternal health awareness month episode and had some of your team members on.
Love it.
Prior to the commercial, we'll take the next little 2 minutes here before our first commercial, Rebecca. Back to operations. As VP of operations. All right. We see it as provider. We, look at a patient's benefits. We get pre-authorizations where an authorization is required. We schedule the appointment. We bring them in, but then the patient has a claim, right? Claim needs to be submitted. There's member services. Care has to be coordinated across the spectrum. What does it actually take to run all of that for 500,000 members? I think that, or more, close to 500,000, or a little over 500,000 members across the state. What is it? What type of engine does that take?
Well, I would say it's not for the faint of heart.
No.
I would also say, operations, and why I've really been drawn to it and made a career of it, is that it's where the work actually happens.
Yes.
So as passionate as I can be about product design or strategy, at the end of the day, somebody's got to actually operationalize all of those big dreams and visions.
True.
And so when I reflect on this question, to me, it's really like anything else, and I won't take you down a path of super technical, but I'd say it's about your people. And it's both about the people that you have, that you are working alongside every day, and most importantly, it's about knowing your people from a customer standpoint. So who are my customers? Those state partners, those providers that, without them, we have no plan.
Absolutely.
Those community advocates and community outreach members, our members themselves. These are my customers, how I'm leaning into their voice, and how I'm making sure that our processes, when things go wrong, that they're left with an experience that they actually feel better. And I think the key to any strong operations is that things will go wrong. And it's when they do go wrong, how did you guide your customer through it? And if you do it right, you actually have a stronger relationship on the other side.
Hey, that's a strong conclusion as we head to a commercial. Operations backed by innovation, personalized plans, caring about individuals, and quality. We're headed to a commercial. We'll be right back.
Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot.
Every Saturday at 10 a.m., we bring the Home Health Care Today show, hosted by Dr. Cleamon Moorer and sponsored by Meridian Health Plan in Michigan. We bring health and wellness topics straight to you. Tune in at 10. Hey, welcome back to the Home Health Care Today show. Yes, it is National Public Health and Medicaid Awareness Week, and we're rocking and rolling with the Vice President of Operations from Meridian Health Plan. So, Rebecca, let's pick up where we left off prior to the commercial. As we think about so many members around the state that are enrolled in a plan, there's some members that have fell in between the cracks. There's been some changes in eligibility and redeterminations of their Medicaid plan. What is Meridian doing to try to make sure that no family or minimal amount of individuals lose plan coverage?
This is definitely a strong focus for us, and I play a big role from an operations standpoint.
Yes.
And the answer is we're doing this work actively every day. Every day, member eligibility can change for this population, and so we're looking at those files in partnership with the state of those members and where they qualify and what coverage offerings they have. And we really, in a very strategic way, when we identify that there's an end date coming up in terms of their current eligibility, we have a myriad of tactics, everything from engagement with our wonderful provider partners from a PCP perspective of making sure we get in touch with the member, our own direct outreach to that member. Our whole goal is making sure that they stay highly informed so that they can make those decisions for themselves or their families to, again, support their healthcare needs. So it's a very strong focus for us.
I get it. This is good. It's good, and it's encouraging folks to reach out to the plan. If you're in between plans, if you're not aware of what your coverage is or benefits, feel free to visit that's mymeridian.com. Rebecca, let's keep going here. All right, so Michigan is a large state. Dr. Haynes and I were talking about, going to the west side of the state, like Grand Rapids, going north to the UP. It's huge, right? And from an operations standpoint, even with our work with Eye Care for Michigan, which is, started as Eye Care for Detroit, driving mobile eye care units around the city, we know we have to go into rural communities and the like, and suburbs, and take care of folks. From an operations standpoint, the scope and the scales of economy are a little off for smaller providers, but for a large plan. How is the organization able to just meet the unique needs of so many Michigan residents? And from an access standpoint, when you think about the digital divide in the rural communities, operationally, how are you all doing it?
So I won't pretend that there's not still a ton of work in front of us.
Sure.
But I think the things that we can tout of being proud of is, how we're working to bring that care to them. The answer is truly, what is the innovation?
Yes.
So there's beautiful things like the mobile clinics that we're doing, like you mentioned. I think that's a very powerful tool. It's also those providers that, and caregivers that go into our homes that can take care of us in that way. Yes. I know we mentioned telehealth already, but when you need that touch time, when you need that real face-to-face time, we are constantly thinking about how to bring that care to them through either home health agencies or through innovative partnerships like we've got with the mobile units.
Wonderful. I love it. I love it. So that, going back to that team, diversity of thought and perspective and problem solving. Because to your point, there's a lot of work yet still to do, but there's not these pie in the sky solutions or a playbook that says, all right, post-pandemic, this is how we operate now, right? When you think about that, in your, illustrious career and professional accomplishments, and many of which you've achieved with your team, and there's not a single individual that does all of this, how does that philosophy of teams and team orientation shape the way Meridian approaches not only operations, but member care when it comes to a team approach?
I would share that this is a personal passion and definitely a part of my leadership.
Yes.
And it's something that's always stuck with me is that saying that if you want to go fast, you go alone. If you want to go far, you go together. And with that, it is that intention. It is that pausing and looking to see who is in the room, who's been invited for the discussion.
Yes.
How do I make sure that the loudest voice, right, isn't the only voice that's heard?
Yes.
And what I can promise you is, and how you think about it and take it back to your own personal lives. When you think about anything you have ever accomplished in this world, you have done it with a group of people. You have not done it alone.
Absolutely.
And who that group of people is, I passionately believe that the more diversity of thought, background, experience, that's how we get to the best outcomes and the best ideas.
Awesome. Hey, so when you combine the the diverse perspectives, the skill sets, the backgrounds, couple that with compassion and care above all else, and then innovation and technology, which is where we're headed to next. We could, provide more solutions, right, for
Yes.
members in our communities. Speaking of which, artificial intelligence and technology, yeah, they're changing the way that not only members interact with their provider, but how they interact with care plans to an extent. Telehealth visits with a provider, digital health enrollment via a phone or a tablet, looking up my chart for test results, opting in for SMS. So opt in for the SMS text messaging from your providers as well as your health plan, because it helps everyone. How is Meridian leveraging innovation, not allowing the innovation to, substitute for hands-on delivery and hands-on care, but how is the health plan leveraging the innovation to improve the member experience, especially for populations that may be technologically averse or on the other side of the digital divide?
I think this is one of the most important responsibilities in managed care right now, is how we are taking our resources and thinking about technology and how it allows us to work differently. I know our CEO talks about, how much is changing and how fast it's changing, the types of tools, the types of AI capabilities that are available to us today that were not available to us even just last year, 6 months ago. So, how we're making those partnerships, and I'd say, where we are today in 2026, and not sure what the future holds, but where we are today, we really are using that philosophy where I had heard somebody once say, and it stuck with me, that I don't want AI to do my art, right? I want AI to allow me the time so that I can make that art. And I think about that with the art of healthcare. And for us, it is really, what are those low-level administrative functions? What is the data, the analysis, more of those back-end operations that technology can give to our operations so that we have more time for the amazingness that the human brain brings in terms of how we use that creativity to serve our customers and our population.
Excellent, excellent. So it's the complement, it's the supplement. To your point, some of the redundant or administrative tasks to an extent, freeing up individuals to do what individuals should do best, which is to care for each other. All right.
Beautifully said.
Hey, we got this. We got it. All right. And for those folks that say, hey, I'm not going to ever use AI, I'm not going to use technology, I don't see too many people riding around with maps anymore or atlases. So the Google Maps and the like, that is artificial intelligence, folks. But industries that are using it to support and to assist healthcare cannot be an industry that doesn't use it, right?
That's right.
So someone is watching right now and they're like, all right, so you guys sold me on the AI. You kind of sold me on reaching out to my health plan and understanding what I need to do to close gaps. But that working parent is like, oh man, I got so much going on. The senior that's at home or the disabled individual is not sure whether they qualify for Medicaid or what all Meridian covers. What should they do right now? What is the first step?
The first step is remembering that the whole design of Medicaid is that it's accessible, that it is there for individuals and families to apply to. And they are incredible resources here in Michigan. Strongly encourage people to go to healthcareformichigan.com. That'll be a great way to start your Medicaid journey. And then also a phone number just to get that plug in, 1-800-975-7630. You can call that anytime as well, and both of those resources will get you started.
Okay, we're going to repeat that one. 1-800-975-7630.
You got it.
Wonderful. Thank you, Rebecca. Last question, and you could, take some time on this, right? Our final question as we close out National Public Health Week and Medicaid Awareness. One message, I'll make it 3 messages, right? A handful of messages. What should every Michigander know watching right now even folks that say, I don't know if I'm a part of the public health system because I live in a remote part of the state, right? Or, I've had quote unquote private insurance per se, or I'm in between insurance plans, right? I don't know what commercial is, or I don't know if I'm old enough yet for Medicare, or if I have a chronic illness that I could be qualified for Medicare, but I guess I'm Medicaid eligible. What are a few things you want folks to know?
I think if you are listening and you are having any coverage concerns, if you aren't aware of what insurance you have, if you don't know what you qualify for, if you feel like this is a gap in your life in any way, you're not alone. And there is a whole team of really passionate, devoted people to making sure that you're supported on that healthcare journey. And, when I think about Michigan and I think about Medicaid, I think one of the hallmarks of any society is how we take care of the most vulnerable people. And Michigan is there for that. And the program we have today with Medicaid here in our state supports it. So be a part of it. Understand your eligibility, use those resources we've provided today. Don't hesitate. The one thing that you can have that nobody can take away from you is your health, and it's our job to take care of it and, use those resources that are available to you to do so.
All right, everyone. Hey, reaching out to mymeridian.com if you have questions about plans, as Rebecca just stated there. And in terms of the Home Healthcare Today show, we're here for you as well every Saturday morning at 10 a.m. We're still in the middle of April here. We started the month, last week. We dove right into minority health awareness. Next week, we are going to look at mental health awareness, right? And we'll conclude our month looking at sexual assault and the impact that has on one's mental health as well as their overall physical health. Stay tuned to the Home Healthcare Today show. We'll see you next week.
I've been seeing my mental health therapist when things are good, when things are bad. The most beautiful thing about the relationship is you have somebody that's in your life. They understand you, and but they're not immersed in your day-to-day life. So you don't ever have to worry about any level of judgment because that's never going to be part of it. But they'll give you, I think, some great advice.
Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today.